AnnMarie Churchill from Step Care Solutions, Alice Ong from the Health Promotion Board, and Jimmy Westenhelm. Did I say that right? Westenhelm? That's fine. Okay, from the Human Aspect. And there are 2 microphones, so you don't have to strain your voice on a Friday afternoon. You can come up to the microphone, but I'll leave it with your hands, AnnMarie.
So thank you, everyone, for being here. We're really excited to have this panel. Alice and Jimmy and I have already had some robust discussions, and we thought, let's bring this to eMHIC. And yes, we would like this to be interactive. So what we thought would be a great approach is that we'll each start, introduce ourselves, and give some context from our own jurisdictions. And then we're going to talk about some barriers and facilitators. The title of this session, so it's not on the screen, so it's about not a standalone, integration of digital into mental health, substance use, health, and addiction services. And there's a reason why we've chosen this topic. And it's because we notice that, and in our work, there are a lot of really great digital solutions, but without integration, we won't maximize the potential. And so, as you heard, my name is AnnMarie Churchill. I'm with Step Care Solutions. And from a Canadian perspective, and you've already heard just in this room, and multiply that by many, many more, there are great digital programs within Canada. When we ran the Wellness Together Canada portal back in 2020 as a COVID response, people really wanted to use it. And you just heard some of Michael's data that people were quite satisfied to use it digital. And as we went forward, and we had to do a lot of work in Canada in our work, and we're a not-for-profit national organization that does system design. So we don't deliver services, we enable the delivery of services in a way that they're relevant. There's a wide continuum of services that are offered, and it's really open access. And what we're trying to do is get better access and better outcomes for everyone. So everyone across the population, despite the need to be able to get what they need when they need it. And as I mentioned, what we've noticed in our work is despite the fact we have really good digital products, people are satisfied with them, we got good evidence behind these, there's still a reluctance to refer to them. There is change management needed. That's what we're seeing as the next step in our work in Canada, is a real change management with primary care, with the population, but even with the media. So one of my frustrations is I still listen to radio. I'm living in St. John's, Newfoundland, and I'll often hear things like, if there's a environmental concern, I'll hear after the article, if you have anxiety, contact a mental health professional. Or if you're worried about this, contact your local care provider. And I'm thinking, they already have a wait list. They're already backlogged. Like, let's give more. Let's say you can do a warm line. There's peer support available. There's lots of services online. So that currently needs to happen, and it's not happening. And so often what I hear, and I've trained clinicians, my background is clinical, and I'll hear, yeah, but when I recommend a digital solution, I feel like, and I heard this from someone this morning, I'm just pushing somebody off to something that is less than. So currently, I will say in our country that digital, at best, is considered supplemental or an add-on, and at worst, it's considered less than. And so we still have a lot of work to do in digital. So I'm happy now to pass the mic to Alice and then to Jimmy, but I want to say first that these are now my award-winning colleagues, because both of you won awards last night for innovation in your respective countries. So I'll pass to Alice, and then Jimmy will give this context, and then we'll each talk about barriers and facilitators, but we'd love for you to join in. We don't want to wait till questions after. This would be really fun if we can all just have a conversation.
Yeah, thank you so much, AnnMarie, for that introduction. So I'm Alice Ong from Singapore's Health Promotion Board. The Health Promotion Board is a statutory board under the Ministry of Health in Singapore. It's really a great pleasure to be part of this panel this morning to talk about how digital innovations are transforming global mental health care. In Singapore, we advocate for mental health and well-being being a core part of overall health and well-being. And from Health Promotion Board, we believe that digital mental health tools are not a standalone. And in fact, they have to be integrated as part of the wider health system so that we can democratize access, we can empower self-care, and we can also complement traditional services. So for the next couple of minutes, I'll just share maybe two of the key digital initiatives we have and how they embed within the larger health system, as I've mentioned earlier. So first and foremost, we have MindSG. MindSG is a resource portal. It is an info hub, and it comprised evidence-based, credible information for anyone to access in the form of videos, articles, self-care exercises, as well as the links to different avenues of help. And it is accessible 24/7, so anyone can access it anytime, anywhere. And this accessibility is very important, and I will share more about that later on. The other product that I'm very excited, very proud of to share is, of course, the Healthy365 mobile application, and that's something that I mentioned at my presentation yesterday afternoon as well. The app is 10 years old this year. It started off as a platform for us to enable our citizens to be able to track their physical health. So number of steps, duration of your physical activity, duration of your sleep every day. But over time, we see the opportunity in it. It is very popular among our citizens. So we also expand it to include other components of mental health and well-being. So today within the app, we also have incorporated things like mindfulness, exercise, tips to manage stress, and so on. And this embedding of mental health into a health and lifestyle app that people uses every day, like the Healthy365, is really important because stigma is still a very big issue and concern in Singapore. And when mental health is being incorporated into something that is an app that people uses every day, it helps to destigmatize. It also normalizes conversations around mental health. And more importantly, we are also sending a very strong signal that health is an overall construct. You know, it's not just physical health or mental health, but it's really both together. And that's really what we are trying to do in the Healthy365 app. So these two initiatives that I mentioned are embedded as part of a wider ecosystem. So we do embed this within our national strategy for mental health and well-being. And we also know that, for example, healthcare providers as well as employers do refer people to all these different tools that we have as part of a wider care plan. So I'll just summarize that of all these initiatives that we have gleaned quite a bit of learning points over the years, but I'll just talk about 4 of them. First, accessibility. So for a digital tool, it has to be really accessible. It has to be available anytime, anywhere, and that's what we hope to achieve with all the digital platforms that we have. Second thing is partnership. I did not manage to say too much about that, but we do partners with quite a lot of stakeholders out there. So one of them is, of course, technology partners like Apple, and we have this product called Lumi Health that, again, we are very happy with as well. And partnerships with clinicians and NGOs really do lend credibility to the work that we do and help us extend reach into the population segments that we are interested in. Third, integration. So like I say, when you embed mental health into something that is as mainstreamed as a health and lifestyle app like Healthy365, it really helps to destigmatize and normalize conversations around mental health. And finally, iteration. Over here, at HPB, we take a really, really serious view about hearing the voices on the ground, knowing what our population needs, and really taking in this feedback to adjust our content, to calibrate our offering so that whatever solutions that we provide will remain engaging and relevant to them. All right. So in short, I would have to say that to us, digital mental health tools are certainly not standalone. We don't even see them as a supplementary add-on. In fact, we see them as an integrated lever, very essential to help us reimagine how mental health care can be delivered. And in my view, I think it is really an open access ecosystem where each and every individual can be empowered to take charge of their health. Thank you.
Thank you very much. For the ones who was here yesterday, they also know that I lived 1 year in Singapore, which is where my life turned around. So I had a big injury there. Then I was met by a fantastic forward-leaning health system on the physical side. But my biggest challenge, of course, in that wasn't that there was the surgery and the physical elements. It was, how do I deal with losing both of my identities on an emotional side? And this was long before you guys came into play in Singapore. So like in Norway, we didn't really have any support for that. And that shifted my life to what I'm doing now, where I'm leading the work in the Human Aspect Foundation, which is a huge platform where we have digitized lived experience. So we have captured people's real lived experiences and done it in a way that now in our business is considered to be like the gold standard of how you do that with, of course, a healthy way of leaning it back in. So I came to this space from the outside, not as a clinician. I wasn't positively indoctrinated at school, right? So I came from the outside as a user, someone with lived experience. So when I started the Human Aspect, I came very naively into it, and then I lived back in Norway, one of the most privileged countries on the planet, just as Singapore, very small, should be easy to do things, right? So you would say, oh, this is a perfect ticket to create something, if you have the ADHD-fueled power that I have in the background. And then every time I came into a room, it was very easy to get access, not like in the US or in Norway. You can suddenly speak to the head of the social welfare services if you just know the right people, right? And now you're sitting where you assume things will happen. You give your presentation, you talk about what we're doing, and we say, imagine that your guidance counselors that is talking to someone that is outside of work can now be empowered with the story of someone else to guide these people back into all the steps they need to do to get back into work. And you saw the stars in his eyes, and all the advisors around him was like, oh my God. And then you follow up with, we're a foundation and it's free. Then you see like, oh, let's do this. And then you leave the room and then nothing, right? Nothing happens. We're talking again about an integrated system that in theory, if he wanted to, like we saw during the pandemic, because then all bureaucracy was suddenly disappeared, we could make changes in a week, right? Then you wonder, at least my kind of personality wonders, but why? Like all the barriers, all the boxes were ticked off. We're literally in a tiny country here. I have a mom that has been outside of the workplace my entire life. I know how it is to be part of that family. We can be part of avoiding that. Even if we're 10%, 15%, doesn't matter. We can improve the service that you guys are doing. Not doing well because you can't address the mental health space. We can help you. So in kind of the bureaucracy of all of this, it isn't just follow the lean business model or follow the systems change training that you find on board, because there's some component in there, which is a human component in these systems. It's designed in a way that is hindering innovation. And we see the same when we came to started talking to people and we presented it and, funding should be easy for you guys. Sounds so wonderful. And then you get the words of, this should be evidence-based. Like, I'm not a research institution. Number one, why should I do research on my own solution? It's subjective. It isn't objective. My goal is to prove that it works. So whatever research I will give you is not going to be, I can't be objective about this. So why don't you connect me with someone else? And then the next question after that is the natural skepticism to this being digital. And they're saying, but what if it hurts people? And then I said, okay, did you know that in the statistics in Norway of suicide, 50% of the people we lose to suicide each year, 50%, 1 out of 2, is literally in care. I don't hear the hospitals getting questions about what if people die, right? So I started asking questions about this, and then suddenly you see that you're knocking around doors, and if you're resilient enough, thank God we were for 10 years, there are opportunities. The pandemic being one. I know a lot of you have taken miles steps during the pandemic because people are forced to be digital suddenly. And for us to round off there, the opportunity that we got was that the Norwegian government put into, for 13 to 16 and 16 to 19-year-olds, we need to address youth mental health. So they said, let's put overarching subjects with criterias of what youth is supposed to know when they finish these two levels. Sounds beautiful, right? And then the teachers were like, I'm not a mental health professional. What do you want me to do? Because there was no tools. So again, a beautiful policy, no resources. What is that? Problem or opportunity? Suddenly we were ready because we were a huge resource hub. We were trusted in Norway, especially among youth. We had millions of users on social media in a tiny country. And we managed to transform because we then went to the teachers and we said, we have the resources, you know school, let's solve it. And now this is being pushed into all the schools in Norway where we made educational programs, but for the subject. So a history teacher can teach it, but you're still meeting the overarching goals. But my kind of point is where we feel the hindrances for real integration is not the people on the ground. The teachers wanted to help us as long as we solve their problems. It's not with the human leaders, but there's something in the system where all these human beings work where this just stops, no matter how beautiful the innovation is. And this is something we need to speak more about to be able to address it, because people are literally dying or families are suffering because this plug is there. And it's in Canada, it's in Singapore, it's in everywhere. But it's beautiful to see how Singapore has, you know, in the last 10 years taken huge steps. I wish I had that when I was struggling with this in Singapore.
So that's so interesting. You mentioned a human component. And what we hear is the same, that people are saying we need these resources. And people who use them say they like them. And it's still been hard to scale them in a way that they're valued and referred to on a level with conventional services. It's often, as I said earlier, that you could try this. Or while you're waiting, I heard someone say that recently, while you're waiting, and I wanted to say, if you're using a digital while you're waiting, you're getting, and Ben Locke mentioned, a therapy. It's therapeutic for many, many people. We have the evidence that shows this. So we still have this sense, and I'm really interested in what you're saying about the human component, because my mind goes to training, goes to professional guilds, goes to a long history in the medical system. You mentioned risk. And I think all of these are creating some hindrances and barriers. But I'm wondering if people in the audience have ideas about barriers that you've noticed, and they're probably similar, and I think along the themes that Jimmy just mentioned and I'm seeing. But do other people have thoughts about the barriers that you've experienced? Yeah. And there's a mic there, and just line up and we'll just talk. We're small enough to be able to have a conversation. Try.
Is it on?
Do you want to use mine?
I'm afraid to touch it. Oh, it was me. Here we go.
Got it.
It was me. It was human error.
It's the human component.
Yeah. Nice, AnnMarie. Jimmy, my question is, or my comment's kind of related to what you said when we talk about barriers, and it's how we use the word risk.
Yeah.
Because when those clinicians say risk, they don't mean to the person receiving services. They mean to themselves generally, right? System risk to their accountability, to whoever they're registered with, and all those things are real. But I come from an entirely lived experience organization as well, and that idea of reframing risk, right? The clinician's motto, made easily, is do no harm, right? And in reality, most bureaucracies have now systems created where risk prevention for the system is actually above that. And we know those things need to be there. And obviously I'm creating it as a bit of a binary, but I see that as a huge barrier. They're afraid to take chances, not out of fear for risk to the people they're serving, but out of fear to themselves. And of course, they're never going to say that in the rooms we need to say that to. But any thoughts on that and how you've kind of navigated that as you've grown?
Yes, I'll try to be quick. So our strategy when we realized the opportunity with schools, right? The opportunity to integrate something into education comes, every 40 years, right? Even in Norway. So we took this very carefully and we said, okay, who do we need? Who do we need to prove a point here? First thing we said, we need the teachers. They are the ones who are giving pushback on something that's supposed to be beautiful. So we needed to understand what their concerns were, and then they were on board. We talk about lived experience need to be part of creating the solution. In our case, teachers needed to be part of creating the solution. The students, they were obviously positive to this, but you still needed to include them to make sure that the solution you created kept that positivity and enthusiasm. So again, include them, but they're kids, so be careful with how you include them, of course. And then was a strategy, okay, but how are we going to not have the same thing? We're going to make something beautiful and it goes nowhere. It's another shelf, beautiful trophy and an award, great, but no end product. And this is where we realized, okay, let's find a region who is willing to take the risk with not just the teacher and the principal and kind of the manager of the school, but also where the municipality leader or a city leader in this case was a human being that I could see the stars in their eyes, and the teacher said, we have an ally here. I know that Anil, in the first conversation he had with me, he said that his beautiful ally in government, sitting back there, he said that without her, we couldn't have done this. So he addressed the same kind of clog in the system as I talked about. And once we had that system in play, we needed funding. Then we found the brave people. And once that was moving, what happened just before I arrived here? The Minister of Education came to the school. She was like, clap, 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 pictures. And she was like, I supported this all along. I'm like, no, you didn't even know it existed, right? So if you can outmaneuver and have something solid going on, that will make sure that the ones above the clog suddenly wants to be part. Now you might be able to remove the clog away from the system and get it pushed in, because you have already answered all the questions. I don't want to say to people that is making new solutions and saying, do the checklist and it will work, because it's not true. Like, there's plenty of good ideas that die by this clog. So let's address the clog for what it is and find ways of getting around it.
I think that's so important. The idea of risk and that the avoidance of risk, and there's something about the mental health system around the stigma on that, that really holds us back from totally engaging with some of these very successful solutions. And Jimmy, I think what I heard you say is the champion piece is really important, is finding a jurisdiction and organization that have the courage, but also, we call it a lot these days, have decolonized, that they don't believe that this is the way you have to do it, that there's other ways and means of doing things and being able to engage with that. And so I'm really curious, Alice, in Singapore, where one of the tactics, and I'll call them tactics, to get policy to practice that I heard is this embedding into health. And that stood out for me because I think there is still a stigma around mental health and substance use health. And so the embedding into the health app and in other policy, because that's something we often say, mental health is health, but we're still separating it out to make sure it gets its due. Can you talk a bit about that, embedding as a facilitator within the health without losing the focus and the desperate attention needed to mental health and substance use health?
Yeah. Actually, I thought that, I thought about the tiered care model earlier in Singapore that we have. It wasn't something that was always there. It was something that was relatively new as part of our National Health and Wellbeing strategy in 2023. And of course, earlier we talked about risk. And actually, I wanted to comment on that I think my colleagues who are operating in tier 2, 3, and 4 would have a lot to say about risk. But thank goodness I'm in tier 1. So the risk is relatively lesser. I think our problem is more of then to get people aware that we have all these different tools available and how to use them and where they are. So access is an issue. And there was quite a lot of conversation about equity this morning as well. And maybe I just want to use the example of a population segment in Singapore where we really had quite a lot of difficulties trying to get them to onboard, not just onto mental health, but really health as an overall construct. And that's really our seniors population. So when we talk about, for example, the Healthy 365 app and how successful it was, and we say that we kind of debunk the myth that seniors can't onboard onto technology and digital tools, That's not entirely true because we did take a very, very long time to get to where we are today. And that's because it is true that inherently, I think the seniors do have barriers to access. Language could be a problem, digital savviness, infrastructure. In Singapore, we are very digitally connected. Almost every household has internet connection. But for various different reasons, some seniors in Singapore just couldn't get on board to the technology. So what do we then do about that? We need to give them access. So we have a lot of initiatives. For example, in terms of if funding is an issue, then in terms of providing the necessary financial incentive to ensure that the seniors in Singapore would be able to get access to a very, very affordable telco plan, as well as mobile device, that's one. How do we overcome this issue of knowing how to navigate all these different tools that's available, where they are, how to use them? We make use of ambassadors on the ground who could be the first touch point for the seniors in the community hubs, for example, to teach them how to use a particular app, for example, how to use your fitness wearable and so on and so forth. And then, of course, capacity building is the other component. And we also subsidize things like workshop, digital literacy, skills building, specifically for the senior population. In Singapore, we also have this initiative called Healthier SG. This was something that, again, kickstarted 2 years ago. I heard that in Canada, everybody has a family physician, and people can get really angry if they don't have a family physician. Yes. In Singapore, that's not the case. In Singapore, we don't have this concept of having a family physician. And we started that 2 years ago with Healthier SG. So it's really looking at a cradle to grave concept, right? So everybody have a family physician. Your family physician would know your overall state of health and so on and so forth. So we are starting over there and hoping that the family physician could help us with social prescribing and really, as I said, embedding mental health into the health agenda. And as in the process of attending to their patients, also be able to share with them what are some of these different digital tools that we have available for mental health and well-being.
That's one of the things you said that I thought was really interesting was you looked at a population that you were having difficulty engaging with. In this case, it was seniors into the technology. And it sounds like a major facilitator is that you invested in onboarding and you funded it well. And you said workshops and engagement, and I think you used other strategies and incentives to help encourage use of the digital. And I'm curious whether that onboarding turned out to be a true facilitator. Was there good evidence of that? And then I see we have a question or a comment and hopefully a facilitator of this embedding. But just a quick question, yeah.
Yeah, maybe I'll just take a quick response to that. Yeah, I think that the facilitator role really helped in getting the seniors on board. It was really difficult in the beginning, but once we have managed to get the momentum growing and we have a critical pool that has been established, actually the peer component comes in very strongly. Okay. So one senior then tell another senior, and then all of them, before you know it, a whole village of them are on board onto the app. So that was how we got it going initially. Yeah.
So that community piece.
Yeah.
Okay. Oh, am I on? No. Yes?
Yeah,
yes?
I can hear.
Okay,
yeah.
Sorry. So I'd like to go back to your question that you started this part. If you can sort of repeat your question again, AnnMarie, like it was concerning what is the reluctance or why is this not being adopted?
Yeah, so we started with the barriers. What are the blocks to this being adopted and integrated and embedded? And then what are the facilitators? And I'm curious if you have ideas about either.
Right. So what I want to comment on are the barriers. Okay. And I think it's maybe one that hasn't been talked about very much. So to start off, my disclaimers. I'm a psychiatrist, everyone. I want you to know that. I am also a Canadian prairie socialist. I believe very strongly in universally accessible social medicine, and I really strongly believe that. I think there are many areas of medicine, mental health being a big one, that has been, governments have basically left this very much to the private sector. And I guess my experience, of when digital mental health, online, virtual kind of entities started being developed and available. Many of them were for profit. And I think we have a lot of that going on in this space. And I think it's a real issue. And it's and you know, I remember when I first started working with police forces and trying to help them to access what they needed for their members who were suffering from PTSD. And they were contracting with these private entities because that was what was available. They had no idea, they had no ability to really, you know, in any way assess, was this good quality or not? And I think people then kind of develop, you know, a skepticism around this. So I don't know what any of you think about that, but I think it's an issue. And quite frankly, at this meeting, I found a lot of that too. I went to there have been a number of talks here where I've been turned off, like I've felt like this, I've been marketed to. This is not, you know, a scientific presentation. Okay, that's it. Thank you.
Thank you for that. And I think Jimmy has a response. It's such a good point. And the skepticism, I think, comes from a number of places. But I think that whole what's behind the service or the digital solution is a really important piece of it. And is it deeply embedded or not? We have 5 more minutes. So I want Jimmy to respond to that. And then I'll try to draw some of the themes together to finish us off.
I just want to credit you for being, you looks like a rapper, you know, she is very confident holding the mic, so she has the MC look, you know. So I wish I could carry the same confidence carrying the mic. So exactly. So to address your point, you know, we are a foundation, so obviously we're on the other side. I would agree with you, and one of the challenges is, I think, is as I said, government, municipalities, and the spaces. I come from a social country, obviously, as well, where most things are free, and then you can argue of the quality of what is free versus what you can buy, but that's another part of the story. Is that they are so slow moving. Right? So if it wasn't for me coming from the outside, and now I see the world of organizations like us delivering quality services and very, very high quality services, we can compete. I'm not afraid of competing. But the challenge is when you don't get any support. If I were to get $1 for each person who told me I should change to being a business because I would get investors, I would be a millionaire, right? Yeah. So the problem is the government haven't addressed that. How can we compete with the ones who have investors? Most of you know that most of the startups that you will find, none of them are profitable. They are invested in and they expect them to be profitable in 10 years. There are people willing to wait 10 years to find the golden unicorn, right? So we need to level the playing field if we are to address what you're saying. And I completely agree, because the problem is also then I would lose people to those because they can pay better than I can, right? So I'm very fortunate that because of lived experience, I have this little positive golden cow. There's a lot of people who are willing to work with and for us because they genuinely believe in what we're doing. And like you, they would not want to work for a competitor where they feel that the energy is different. It's more about selling something than actually solving something. But again, that is unique. So I think the government, and you know, as someone who is not the most engaged in policy, as a general point, I want to do things, but I think here policy would be important. Yeah. We need to level the playing field. Then you need to do some form of policy where it's possible for us to actually compete on an equal ground, because then I think people, the users, would more often choose the services that feels right to their needs instead of feeling like the cheap option is not the same quality, because over here there's so much money to make it look fancy, they market it better than you, and they show all the research that we can't afford to make, right? But maybe our product is better. They will never know.
Yeah. Thanks so much for that response, Jimmy. So in conclusion, I'm wrapping up. I think we're all here. We all agree that digital is an absolute essential component of mental health and substance use health systems. There are barriers, and I love the idea of the human connection, the human point that creates real barriers, but also the funding, the marketing, the profit making. There's a proliferation and it creates a skepticism. And I think those are real barriers. And I love the facilitators and I like where Singapore is going. I love the idea of the peer connection and the peer support around onboarding in digital. I think that's going to be critical. And then it speaks for itself and it develops a community around that. So I love that. And I think the question around, is it embedded in health? And if it's embedded in health, how do we make sure that the mental health and substance use health doesn't become a medical condition? We heard about the pathologizing today, that we stay squarely focused on the experience of mental health, wellness, mental illness, and recovery. So thank you all for being here. That was fun. And thank you to Jimmy and Alice for participating.